My name is Laurice Levine. I have transfusion-dependent beta thalassemia, and I've been coming to MarinHealth for care for 5 years.
When I met Laurice, I became educated about transfusion-dependent thalassemia because she is an expert in her own condition. Thalassemia is an inherited blood disorder that can be devastating.
Basically, people with thalassemia make zero or very little hemoglobin. I was diagnosed at 14 months old. My parents were told I wouldn't survive past the age of 13 when I was born. So I survived, but I did not thrive. I was very sick as a child. I couldn't do PE. You know, we lived on a hill and I couldn't walk up the hill. I had heart failure when I was 9. I had heart failure again when I was 25 because of severe anemia, and I started blood transfusions at age 25. So I've been doing this therapy for 25 years. I've received 601 transfusions, has translated to about like 1,300 units of blood. That's 1,300 people that have helped me that I don't know. And I want to be worth that blood, so I have to give back. Blood donors are special and they're precious, and blood is scarce.
The challenges of so many transfusions, or having transfusions that often, is the iron overload. It's more than simply just transfusion every 2 weeks. If we weren't able to provide her with the transfusions every 2 weeks, the complications of the thalassemia would be severe. So she's quite remarkable. I find it incredible, as active as she is as a working mom, taking care of her health, which is a full-time job, and yet having a full life, personal life and professional life.
It means just constant juggling. I've been married 18 years and have a 7-year-old. I work full-time, trying to run a household and make sure my son is at camp and does all the 7-year-old things. Then there's the infusions of Desperal that I do 5 days a week. It's a lot. MarinHealth is probably the most stellar care I've ever received at any hospital, and I've been a patient at many hospitals in many different states. World-class care, but it's 30 minutes from my house. I don't have to travel. I don't have to think too hard. My doctors and nurses are the best. They show so much compassion. I'm so grateful.